Hi everyone. Today I am coming to you with a very special guest, Ms. Rachel Jones. Rachel has been my Fulbright Scholar for the last 1 year. I can call her a global citizen. Rachel, you know why I call you a global citizen, right? Because she has essentially lived in multiple countries. She'll tell you about that herself. But the point is, this is the first time she has actually lived in India, although she was born in India. This is the first time she's actually lived and worked in India for an extended period of time. So it's been a special time for us working with her, enjoying her presence, her fun-filled days with us. Rachel, global citizen, what countries have you lived in?
So I have a pretty extensive background. I was born in India, like Dr. Mathew said. Lived there for a couple of years before moving to Australia. And then we shifted to Malaysia and then to the United States, first to Pennsylvania, Pittsburgh specifically, and then to Long Island, New York.
So it's been your first time living in India independently.
Yes.
And experiencing India as all of us experiences it.
Yeah.
When you were thinking of actually coming to stay here, although you know a little bit of Malayalam, although you were born here, I'm sure there must be some sort of a trepidation, some anxiety, right? Did you have such concern or anxiety? Or if so, what was it about? If not, why not?
So that's a very interesting question. I think I did have some trepidation, some anxiety, but that was inconsequential to the amount of excitement I had coming back here, trying to rediscover my roots, trying to improve my language skills. It was a very interesting experience. I'm very grateful for it too.
But in a sense, when you came here,
Yes.
you said you were trying to rediscover your roots.
Yeah.
Or learn the language, improve your language skills.
Yeah.
But I feel you did more than that, much more than that. Looking back over the last 1 year, what are the few things that you really experienced and gained in life?
I feel like living here has allowed me to become a little bit more confident. Before, I would say, I am technically a shy person, but living here has given me a little boost of confidence, speaking in another language that I'm not as proficient as.
As a Fulbrighter, you've been here for the past 1 year. There are certain things that you've achieved. I know for a fact, but what are they? Can you explain to the audience what have you done in the past 1 year?
Yeah, so it's definitely been a productive year. I've been involved with the new startup company, the new healthcare app, Mevo, that we're developing and trying to promote to the patients. That's certainly been an interesting experience, interacting with the patients, trying to implement patient-reported outcome measures within the clinic and trying to make that more commonplace. And we've also been involved in trying to analyze the effect of AI and its influence in healthcare.
And one of these projects, I'm very curious to hear about the Mel app. You actually piloted the initial patients, around 90 plus patients, right?
Yeah.
Can you explain what that meant? What did you actually do during that time?
So that was a very interesting time for me because I could really put my language skills in practice. So I would go and interact with the patients after they've met up with Dr. Mathew for their appointments and introduce the app to them. We had flyers and we gave them the option of receiving it either in English or Malayalam. And basically what I would do is explain to them how to use the app, try to convince them and make them understand its relevance and importance. And I would also track the app usage, how they would use the app, how frequently they would log their symptoms, how frequently they would track their medications, and I would follow up with them on there.
Rachel was actually the first author of a publication, a seminal publication from my group, published in American Society of Clinical Oncology's electronic journal. She presented the first pilot data on using patient-reported outcome measures in a clinic. I think the first, to best of my knowledge, first ever such data from a low and middle income country. So I think you've actually put an indelible mark on oncology, at least from the Indian perspective as I see it. Looking forward, the skill set that you've achieved during this time in Fulbright here, what are things that you can translate to your future life experience in the US or anywhere in the world?
So I think one of the greatest skills that I've achieved here is my sense of adaptability. Living here has been great, but it's had its challenges of its own. So to adapt to that and not only quote unquote survive, but also thrive is something that I can take with me for the rest of my life, no matter where I go, what I do.
And I think you'll do great with that. There's a skill set that you've achieved here, that you've gained here, and you can definitely use it anywhere else in the world. And I'm foreseeing a great future for you in whatever career you choose. But here's some rapid fire question. Your favorite food that you discovered here in Kerala?
Definitely appam.
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 What do you like to go with it?
I would anything, honestly. Egg curry, beef curry, anything.
Your favorite place in the city of Kochi?
Probably Fort Kochi. Very, very nice place to walk around and see all the history and everything.
Did you have any favorite person or persons that you've discovered in Kerala?
Honestly, your whole clinic, your whole staff, very friendly people. I commend you for the amazing, talented people you keep around you, your students, all your...
The nursing staff and everybody have been awesome, right?
Yeah.
They've enjoyed your presence, your so much. So I'm sure they will miss you a lot. But favorite place in India? Did you travel much?
I did travel to Goa and I did travel to Jaipur for the Fulbright conference, mid-year South Asian conference. But I would have to say I'm sticking to the roots. I think Kerala is my favorite place in India, yeah.
You've been to Munnar also, right?
Yeah.
I was thinking you're going to say Munnar as your favorite place in Kerala. Rachel, as a Fulbrighter living here independently, for that matter, any person living independently here, as a woman, how did you feel about the safety environment?
I've always felt very safe here in Kochi. Obviously, I can't say the same for all of India, but I've had nothing but the best experiences. Obviously, it's important to be culturally aware and cognizant of your surroundings, but I would say overall very safe.
That's good to hear.
Yeah.
Rachel, so going back to the US, will you come back again? Not just to visit, would you consider working here for it at some point of time?
I loved my time here and I would love to come again. I would say to that question, I would say that the future is uncertain. I would love to work here, but we'll see what the future holds for me.
Yeah, I'm very optimistic about that. And I think you've gained considerable knowledge, skills about the place itself. That any career that you choose ahead of time, in your future, you can use the skills that you gained in the last 1 year. And besides, I do foresee a place or a space where you will be able to give back to your hometown or place of birth. Yeah, so I see a lot of future. I'm grateful to the wonderful time that you've had with all of my staff, my colleagues, and the place here. And I think the best that is just yet to come in your case. So my best wishes, Rachel Jones, going back to the US after serving a year as a Fulbright Scholar. Thank you, Rachel.
Thank you.